The vertebral column, also known as spine or backbone, is a crucial structure in the human body. It serves as the main support for the body, protects the spinal cord, and allows for movement. In this, we will explore the anatomy, the function, and significance of the vertebral column. The vertebral column consists of total 33 vertebrae, which are stacked upon one another and divided into 5 regions. The first is cervical region, which is present in neck. There are 7 cervical vertebrae. The next is thoracic region. There are 12 thoracic vertebrae. The third is lumbar region, which is present in lower back. There are 5 lumbar vertebrae. The fourth is sacral region, which is present in pelvic area. There are 5 sacral vertebrae fused to form a single triangular bone known as sacrum. And the fifth is coccygeal region, which is also known as tailbone. There are 4 coccygeal vertebrae which are fused together to form the coccyx or the tailbone. The C1 vertebrae, commonly known as atlas, is the first cervical vertebrae in the spine. It plays a crucial role in supporting the skull and enabling the range of motion in the head, particularly in nodding, that is flexion and extension. Unlike most vertebrae, the atlas lacks a vertebral body. Instead, it consists of a ring-like structure made up of anterior and the posterior arch. The anterior arch forms the front part of the ring. It contains the anterior tubercle, a small projection which serves as an attachment point for ligament. The anterior arch has a facet for the odontoid process of C2 vertebrae. The posterior arch forms the back portion of the ring and is slightly thicker than the anterior arch. It contains the posterior tubercle, which also serves as an attachment point for the muscles and ligament. The posterior arch also has a groove for vertebral artery, which passes through the atlas on its way to brain. On the either side of atlas, there are 2 large lateral masses. These masses are thick, compact portion of bone that provide support and stability. The lateral masses have superior and inferior articular facet. Vertebral foramen. The large circular vertebral foramen in the center of atlas allow for the passage of spinal cord. The atlas has 2 prominent transverse processes on the either side which project laterally. The transverse foramen within these processes allow for the passage of vertebral arteries which supply blood to the brain. The C2 vertebrae, also known as axis, is the second cervical vertebrae and plays a crucial role in movement and stability of the cervical spine. The dens is the most distinctive feature of the axis. It is a peg-like bony projection that extends upward from the body of C2. The dens fit into the ring of the atlas and act as a pivot point for the rotation of the head. This allows the head to turn from side to side as when shaking the head no. Vertebral body of the axis is larger and stronger than that of the atlas, providing support for the head and neck. The spinous process of axis is prominent and bifid, split into 2 parts in most of the individuals. This process extends posteriorly from the vertebral arch and serves as an attachment point for muscles and ligament. The lamina are the flat bony plate that form the posterior portion of the vertebral arch. They connect to the transverse process and protect the spinal cord by forming the vertebral foramen. The axis has 2 transverse processes which are laterally positioned and serve as attachment point for muscles and ligament. This process also contains the transverse foramen through which the vertebral arteries pass on their way to the brain. The axis features superior articular facet and the inferior articular facet. The vertebral foramen in the axis is the opening that surround and protect the spinal cord as it passes through the cervical region of the spine. All the cervical vertebrae from C3 to C7 share several key anatomical features, although their size and some structures may vary slightly to accommodate the increasing body weight and motion demands as you move down to the neck. The vertebral bodies of C3 to C7 are relatively small compared to those of thoracic and lumbar vertebrae, as the cervical region of the spine needs to be both strong and flexible. The vertebral foramen is the large hole through which the spinal cord passes. The spinous processes are the bony protrusions that extend posteriorly from the vertebral arch. The spinous process of C3 to C7 are relatively short and are easily palpable along the back of the neck. In fact, the spinous process of C7 is especially prominent and often referred to as vertebrae prominence. The transverse process project laterally from each side of the vertebrae and serve as an attachment point of muscles and ligament. These processes have transverse foramen which allow the vertebral arteries to pass through and supply blood to brain. This is C7 vertebrae prominence. The spinous process of C7 is longer and more pronounced than those of other cervical vertebrae, making it easily felt at the base of the neck. This prominence is why C7 is often used as landmark in clinical examination. C7 has larger transverse process compared to other cervical vertebrae, and its transverse foramina are often smaller or absent. This is because the vertebral artery is no longer passing through C7, it only passes through C1 to C6. The vertebral artery of C7 is the largest in the cervical region, providing more support as the load of the head increases. Thank you. Kindly like, share and subscribe my channel.